Can a menstrual cup actually suck out your cervix?
Oh boy,
Right. It sounds like a terrifying urban legend, like something you'd hear whispered in a high school locker room.
it really does.
But, when you actually start looking into the medical guidelines for using menstrual cups after gynecological treatments, things get very murky very
They
fast.
do. It is the absolute definition of diagnostic muddy waters.
Yeah.
I mean, the guidance out there ranges from incredibly strict to just wildly vague.
And that is exactly what we are getting into today. So welcome to this deep dive.
Glad to be here.
If you're listening to this, you are probably someone who loves an efficient, sustainable routine. You've got your zero waste period care down to an absolute science.
Which is great, obviously.
Totally great. So having to suddenly abandon your trusted cup because of a medical procedure
Right.
and then being handed the stack of contradictory pamphlets as you walk out of the clinic, well, it can be incredibly frustrating.
It's super confusing because the timelines you get from different hospitals are just all over the map.
Completely all over the map. Why do some clinics tell you to wait a mere 2 weeks, while others insist on 6 whole weeks?
It's a huge gap.
It really is. So today, our mission is to synthesize these timelines. We're going to look at the actual physics of how these cups work inside the body and figure out exactly when it's safe to resume your routine.
And more importantly, why those waiting periods are so critical.
Exactly. So let's start our journey right at the doorway to the uterus, which is the cervix.
The cervix really is the gatekeeper here.
Yeah, because this is where the most common cell change treatments occur, right? And where the rules about menstrual cups seem to be the absolute strictest.
Yeah, that's spot on. And the most common procedure you'll see in the guidelines we're analyzing today is something called a LLETV.
Right, LLETZ,
Right.
which stands for large loop excision of the transformation zone.
Correct. So if abnormal precancerous cells are found during a routine cervical screening, LLEPZ is the standard go-to treatment.
And it's pretty successful, isn't it?
Oh, incredibly. It's an amazing procedure with over a 90% success rate at stopping those abnormal cells from ever developing into cancer.
Wow. Okay, so walk us through what actually happens to the tissue during a LLTZ, because
Yeah.
I feel like understanding the wound is really the only way to understand the recovery timeline.
Definitely. So the procedure is usually done right in an outpatient clinic. The doctor uses a very thin wire loop that actually has an electrical current running through it.
Like a hot wire.
Basically, yeah. This electrified wire acts as a highly precise scalpel. It simultaneously cuts away the abnormal tissue and immediately seals the wound right behind it.
Oh, wow.
Yeah, it's a process called cauterizing.
So it's cutting and burning at the exact same time. That means the body is essentially forming a scab right there on the cervix, right?
Yes, exactly. And the clinical term for that internal scab is an eschar,
An eschar.
right? And the healing process for this eschar follows a very specific biological clock.
Okay, what does that look like?
Well, initially, for the first week or so, you might just experience some watery discharge. But then, right around day 10, things shift.
What happens at day 10?
As that soft internal scab begins to heal and sort of slough off, it is incredibly common to see a dark, gritty, coffee granule-like discharge.
Oh, interesting. Let me throw out an analogy here because I think it really helps to visualize what's happening inside.
Go for it.
So imagine you fall off a bike and you skin your knee pretty badly. Your body forms this delicate scab over the scrape.
Right.
If you were to put a tight, non-breathable rubber bandage directly over that fresh scab and then constantly rub it as you walk.
It would be a mess.
Exactly. The scab is going to get mushy, it's going to get disrupted, and it's going to start bleeding all over again. So the healing cervix is essentially that freshly skinned knee, but located in an environment that is constantly warm and wet.
That is a highly accurate way to look at it, actually. You have this fragile layer of healing cells in a very active environment.
Right.
And this brings us right to the confusion over the timelines. Because you are waiting for that internal skinned knee to reach a baseline level of structural integrity.
But the advice on when that integrity is reached is just everywhere.
It really is.
Like if you look at the discharge paperwork from the Maven Center in Australia, they suggest avoiding cups for at least 2 weeks post-LLETZ.
2 weeks, yeah.
But then if you pull up the guidelines from UK NHS trusts like Gateshead in Manchester, along with the Eve appeal, they draw a hard line at 4 weeks.
A huge difference.
Then it gets wilder. If you go even further and read the guidelines from the University of Hong Kong or Pardee and Associates, they advise waiting a full 6 weeks.
Yeah, and we also have to factor in colposcopies with a targeted cervical biopsy.
Right, which is a bit different.
Exactly. That's where they just take a tiny pinch of a sample rather than a large loop excision. The wait time there is generally shorter, ranging from maybe 7 days to 4 weeks.
Though it's definitely worth noting that with those smaller biopsies, doctors often apply a thick brown honey-like paste to stop the bleeding.
Yes, Monsel's solution.
Right, and that paste needs time to naturally exit the body, which also causes a very dark, gritty discharge for a few days.
So in all these scenarios, you basically have this cocktail of healing tissue, active discharge, and highly vulnerable cell barriers.
Which leads me to a major pushback on behalf of the listener here.
Okay, let's hear it.
Let's say I have a premium medical grade silicone menstrual cup. I boil it on my stove for 20 minutes. It is completely 100% sterilized.
Sure.
Why is it still banned for up to 6 weeks? I mean, if the cup is sterile, shouldn't it be perfectly safe to put against a healing wound?
It's a very logical question, but it misses a fundamental biological reality.
Which is?
The risk isn't actually coming from the cup itself. It's about the environment the cup creates once it's inside you.
Oh, I see.
You can boil that cup until it's sterile, sure, but your vagina is not an autoclave. It is not a sterile environment, nor should it be. It has a complex, delicate microbiome made up of natural bacteria.
Right, so even a perfectly clean cup is entering a space that is already full of bacteria.
Exactly. When you insert a cup, it sits high up in the vaginal canal, right, flush against the cervix.
Trapping everything above it.
Yes. It traps that natural vaginal bacteria, along with the menstrual blood, the water discharge, and all the sloughing tissue from the surgical wound.
That sounds like a recipe for disaster.
It is. Blood actually changes the local pH, making it less acidic. So you're effectively creating a warm, moist, pH-altered stagnant incubator and pressing it directly against a highly vulnerable healing site.
Wow. So you aren't introducing an external infection at all. You are just trapping the body's own natural bacteria against a compromised doorway.
Yes, exactly. And beyond the bacterial incubator risk, there is the raw mechanical risk to think about.
The actual physical cup.
Right. The physical insertion of the cup and the friction it creates can mechanically disrupt that delicate scab. We use the term friable in medicine to describe this kind of tissue.
Friable. Meaning what exactly? Like easily broken.
Basically, friable means the tissue is fragile, easily irritated, and prone to crumbling or bleeding with even the slightest touch.
Ouch.
A healing cervix is highly friable. The Royal College of Obstetricians and Gynecologists actually notes that up to 15% of patients experience delayed hemorrhaging after a LLETZ.
15%. That's quite a lot.
It is. And very often, this happens because that friable Escher is disturbed mechanically before it's really ready.
That makes total sense. So it's not just the cleanliness of the silicone, it's the sheer physics of a physical object pressing against friable biology.
Exactly.
So we've talked about what happens when the gates of the cervix are wounded. But what happens when a procedure forces those gates open entirely and goes straight into the uterus? Because that introduces a whole new level of risk, right?
It really does. And the most common procedure we see in this category is a hysteroscopy.
Right. A hysteroscopy is where a tiny camera or a telescope is passed through the vagina, forcefully through the cervix, and right into the womb.
Yep. And during this procedure, doctors often use a clear saline fluid.
What's the fluid for?
They gently pump it into the uterus to expand the cavity, literally pushing the walls apart so the camera can get a clear panoramic view of the lining.
Fascinating.
It's an incredible diagnostic tool. It's used to investigate heavy bleeding, remove polyps, or sometimes even to retrieve lost contraceptive coils.
But the timeline post-hysteroscopy is incredibly strict, right?
Very straight.
Patients can expect period-like bleeding for 7 to 10 days, sometimes lingering up to 2 weeks. And the absolute rule across the NHS and almost every clinic in our research is to completely avoid menstrual cups and tampons until after your next normal period.
Right. And that next normal period rule extends to other major uterine events as well.
Like what?
Well, guidelines for Menstrual Cups Australia Online explicitly state you must wait until your next normal period after giving birth, having a miscarriage, or having an abortion.
Okay, let me try a different analogy for the uterus here, because we're talking about a very different environment than the cervix.
I love the analogies. Let's hear it.
Think of the healing uterus like a self-cleaning plumbing system that relies entirely on gravity and drainage.
Okay.
The body flushes water and debris down a one-way pipe. If you put a rubber plug right in the only drain, that debris has nowhere to go. It backs up into the delicate machinery.
That is spot on. You are essentially dealing with a one-way flushing mechanism.
But I have to ask, is it that clear saline fluid they pump in during the hysteroscopy that makes the uterus so vulnerable afterward? Like, is the saline what we are actively trying to flush out?
It's a common misconception, actually, but it's less about the saline fluid
Oh,
itself.
really?
Yeah. The saline is sterile and mostly drains out very quickly while you're still in the clinic anyway. The real issue is that the protective barrier of the cervix has been breached.
Ah.
It was mechanically opened up for the camera, and the endometrial lining, the inside of the uterus, has been disturbed.
So the castle gates are essentially wedged open.
Precisely. The body's primary natural defense against infection in the uterus is the downward, unimpeded flow of blood and discharge.
That is the self-cleaning system you were talking about.
Exactly. When you insert a menstrual cup, you are placing a physical stopper right at the exit. You block that natural downward flow, and by trapping that fluid, you risk giving bacteria a bridge to climb right up through that open cervix and into a highly vulnerable uterine cavity.
You're clogging the drain while the system is trying to run a cleaning cycle.
That's exactly it.
Okay, here is where this gets deeply fascinating to me.
Mm-hmm.
We've established that trapping fluid is bad because of the bacteria, but there is a unique physical factor to menstrual cups that pads and even tampons just do not have, and that is the actual physics of suction.
The vacuum seal, yes.
Right.
It is the core engineering feature that makes the cup work so effectively in the first place.
Mm-hmm.
But it introduces a whole new set of mechanical variables that we have to talk about.
Let's break down how that actually works inside the body, because it's not just sitting there like a cup on a table.
No, not at all. It's an active mechanical force.
How so?
When you fold a menstrual cup and insert it, it pops open inside the vaginal canal. Because of its bell shape, as it opens against the walls of the vagina, it displaces air and creates negative pressure.
And that negative pressure is the vacuum seal that prevents leaks.
Exactly.
And under normal conditions, a healthy cervix and healthy vaginal walls have the tensile strength to withstand that negative pressure without a single problem.
Right. Healthy tissue handles it perfectly fine.
Mm.
But we really see the risks of this suction when we look at the insertion of intrauterine contraception, IUCs or coils. The Faculty of Sexual and Reproductive Health Care notes that some clinicians advise avoiding cups for several weeks post-insertion.
Now, wait, is there actual clinical proof that the suction of a menstrual cup can pull a coil completely out of the uterus? Or are doctors just sort of guessing because they're being overly cautious?
The clinical evidence is actually somewhat mixed on this one.
Really?
Yeah, some studies show no increased risk, while others show a slight correlation. But the theoretical risk is sound enough that caution is highly advised.
That makes sense.
Remember, an IUC has thin strings that hang down through the cervix into the vaginal canal. When you go to remove a menstrual cup, if you don't properly break that vacuum seal first, the downward suction force acts directly on the cervix and on those strings.
It's like pulling a plunger down a pipe.
Exactly.
Which brings me to the Cosmopolitan article I was reading while we were prepping for this. It honestly terrified me.
Oh, I know the one.
Yeah, it directly addresses the myth we started the show with. Can a menstrual cup actually suck your cervix out?
It is a visually horrific thought. I mean, let's just admit that.
Truly nightmare fuel.
Now, the expert in the article clarifies that a cup won't literally suck your cervix entirely out of your body like a vacuum cleaner.
Right, no.
But they do note that removing a cup without properly breaking the suction seal first can cause severe swelling, bruising, and trauma to the cervix that actually requires medical intervention.
Yes.
Is this just media fear-mongering and extreme user error? Like, if you just remember to pinch the base of the cup, are you basically fine? Or is the suction of a menstrual cup actually a medically significant force?
It absolutely is a medically significant force. Yes, user error, like forgetting to pinch the base to break the seal, is the primary culprit for severe pain. But we cannot dismiss the suction as trivial.
Sure.
It is a real, measurable vacuum force. And this isn't just media hype. There's a very specific case study we looked at from a Reddit user that illustrates the anatomical realities of this perfectly.
Let's talk about that case, because it really opened my eyes.
Yeah. This was a user who had been happily and successfully using a menstrual cup for 5 whole years, but she ended up experiencing a mild prolapse and severe cervical trauma.
Specifically, a cystocele.
What is that?
Which is a condition where the supportive tissues weaken and the bladder actually drops or prolapses down into the vaginal canal.
Oh, wow. Right. And her doctor discovered that because she had an unusually large cervix that sat lower in the vaginal canal, The cup wasn't actually cupping around the cervix like a catcher's mitt.
Right, it didn't fit properly.
It was wedged, intensely rubbing against the side of it, while still maintaining a tight vacuum seal.
Which highlights a really crucial point. Anatomy varies wildly from person to person. If the cervix is low or enlarged, the cup competes for space.
Makes sense.
Add the friction of daily movement to a constant vacuum seal on the side of the cervix, and over time, that mechanical stress can absolutely contribute to tissue trauma or exacerbate a mild prolapse.
This raises such an important question about how we view these sustainable products. I mean, we tend to think of them as entirely benign just because they're eco-friendly and made of silicone.
Exactly, but they are still medical devices interacting with human anatomy. There are absolute contraindications for menstrual cups.
Like what?
You really shouldn't use them if you have active pelvic inflammatory disease, unexplained heavy pelvic pain, or severe anatomical variations like a prolapse. Well, unless you have explicit clearance from a doctor.
So to loop this back to post-operative care, under normal conditions, the tissue is strong enough. But when those tissues are friable from a biopsy or when they are holding a newly placed delicate coil string,
It's a totally different story.
right, that standard everyday vacuum force is absolutely enough to cause mechanical trauma. It can literally tear a healing essure right off the cervix.
Exactly. It's not about the cup being inherently dangerous. It's about the tissue being temporarily too fragile to handle the cup's normal operating mechanics. Waiting for baseline tissue health is just completely non-negotiable.
Okay, so what does this all mean for you listening right now? We understand the mechanical suction, we understand the bacterial incubator effect, and we know the timelines range from a week to 6 weeks.
Right.
How do we synthesize this into a practical, overarching game plan for recovery? Like, what is the golden rule here?
The absolute consensus across all the medical literature we've reviewed is this. When in doubt, a minimum of 4 weeks or until your next normal menstrual cycle is the safest bet for any procedure involving the cervix or uterus.
4 weeks. Mark it on the calendar. Buy the pads.
Yep, by the pads.
And what should you expect during a healthy, normal... Wait, what does normal healing actually look like?
So a healthy recovery involves that watery discharge we discussed earlier, followed by the coffee ground discharge right around week 2.
Okay.
You'll likely have some mild cramping, and it is very common for your first period after a procedure to be slightly out of sync or even heavier than usual.
But there are red flags, right? Things that mean you shouldn't just wait it out, but that you need to seek immediate medical intervention.
Yes, the red flags are incredibly definitive. If you are soaking through a heavy sanitary pad every hour for 2 hours straight,
Okay.
if your discharge becomes foul-smelling yellow or green, or if you develop a fever, chills, or severe pain that does not respond at all to over-the-counter painkillers.
Basically signs of a serious infection.
Exactly. Those are clear signs of infection or hemorrhage, and you need to see a doctor immediately.
And this actually brings up a really crucial point about how we monitor our healing. During this waiting period, doctors tell you to use external sanitary pads.
Right.
That isn't just an arbitrary hygiene rule. The pads are actually a vital diagnostic tool.
They absolutely are, because, well, you cannot see inside your body, so you have to rely entirely on what is coming out.
Makes sense.
An external pad allows you to accurately monitor the volume of blood loss and the exact color and consistency of the discharge.
Whereas a cup,
A menstrual cup obscures that vital data. You really don't know how fast you're bleeding until you take it out.
you lose the visual data completely. But I have one more highly practical question on behalf of the listener, because I know this is exactly what I would be thinking.
Sure.
Let's say a patient has LLETZ procedure. A week goes by, they feel totally fine, they have zero pain, and their bleeding completely stops after just 3 days.
Good.
Why on earth do they still have to wait the full 4 weeks to use their cup? I mean, it feels like dramatic overkill.
I hear that from patients all the time, and it's a vital distinction to make. We really have to separate the concept of feeling healed from the biological reality of cellular healing.
What's the exact difference?
It comes down to how our nervous system is wired. The cervix and the inside of the uterus just do not have the same types of pain receptors as our skin does.
Oh, really?
Yeah. Our skin has somatic nerves, which are highly localized. If you scratch your arm, you know exactly where the scratch is. But our internal organs rely on visceral nerves.
Visceral nerves, so they sense pain differently.
Entirely differently. Visceral nerves generally only register deep stretching, cramping, or widespread inflammation.
Okay.
They do not register sharp, localized pain like a cut or a scab tearing. So you literally cannot feel a vulnerable, half-healed scab on your cervix the way you can feel a tender scab on your arm.
Oh, wow. That is a massive realization.
Right. The tissue might still be incredibly friable, the Escher might still be barely attached, but your brain isn't receiving a localized pain signal telling you to protect it.
That's terrifying, actually.
It is. If you insert a cup and create a vacuum seal just because you feel fine, you risk ripping that unseen scab right off. You just have to trust the biological timeline, not just your lack of pain.
Wow. That completely reframes the whole waiting period for me. You literally cannot feel the danger zone.
You really can't.
You might be actively injuring yourself and have absolutely no idea until you start hemorrhaging.
Exactly. Biology requires time, regardless of how we perceive it on the outside.
Okay, let's bring this all together. We have covered a lot of vital ground today. You've learned that the question of how soon can I use a menstrual cup after treatment is governed by real physical mechanics.
Yes.
The timelines aren't just arbitrary numbers pulled out of a hat by overly cautious doctors. They range from a week for a simple biopsy to up to 6 weeks for a LLETZ, and it is all in the name of 3 vital goals.
Preventing bacterial infection by keeping the drain clear, allowing delicate scabs to achieve full cellular healing, and avoiding the mechanical trauma of vacuum suction on highly friable tissue.
It's all about respecting the mechanics of the healing process. But before we wrap up, I want to leave you with a thought to ponder, a bit of a look into the future of women's health.
Oh, I always love a good hypothetical design challenge.
We focus so much on sustainable period care these days. You know, cups, discs, period underwear, it's a massive industry.
Yeah.
But post-operative care is still entirely reliant on disposable, single-use pads. Given all the physics and biology we've just discussed, will the future of gynecology bring about newly designed, eco-friendly post-operative products?
It's a fascinating engineering puzzle, honestly. It would have to completely bypass the suction problem entirely.
Right, like, could we see the invention of a zero-suction, completely sterile, reusable medical receptacle?
That would be amazing.
Something designed specifically to accommodate the friable anatomy of post-cervical treatments. Something that, bridges the gap between the diagnostic, visual necessity of a pad and the zero-waste sustainability of a cup.
It would have to allow for downward flow without trapping any bacteria, and somehow remain sterile. I mean, it's a tall order, but medical engineering is always advancing.
It's definitely something to think about the next time you're frustrated by having to buy a plastic-wrapped pack of pads while you recover. And it brings us right back to where we started. The reproductive system heals in the dark. It doesn't give you a neat little X-ray to show you when the job is done. It is murky, it is complex, and it is beautifully delicate.
And because you can't feel the progress, sometimes the absolute best medicine is just giving your body the uninterrupted time it needs in those muddy waters.
Exactly. Give it the time, respect the suction, and let the healing happen. Thanks for taking this deep dive with us.